Welcome to the deep dive. Today, we're going straight into your collection of information on a really critical topic, preventing and treating injuries in MMA.
Yeah, it's a big one. We've got a really rich set of sources here.
Definitely. We're talking insights from UFC champions, Hall of Famers, top trainers, and medical pros who are right there in the trenches.
hmm And our mission, basically, is to pull out the most crucial bits of knowledge.
Right, to help you understand the risks, the prevention methods, and, the treatment options in what's obviously a super demanding sport.
And what jumps out right away, I think, is how MMA training has evolved. It's pretty fascinating.
How so?
Well, it wasn't that long ago, really, that it was all about just being the toughest guy.
Yeah.
The philosophy was just grit.
Right, survival of the fittest in the gym.
Exactly. But now you see these incredibly sophisticated year-round conditioning programs for the elite athletes. It's night and day.
Okay, so that's the interesting nugget then, the evolution.
Well, that's part of it. But the concerning part, which a lot of these experts bring up, is whether the support system injury prevention treatment has actually kept pace.
Ah, I see. So the training got super advanced, but maybe the safety net lagged behind?
That's the worry. It's like a crucial gap that we really need to dig into here.
It's like building these high-tech race cars, but still using, I don't know, old garage tools for repairs in some areas.
So that's a good analogy, yeah.
And the sources, I mean, it's an incredible lineup. We've got wisdom from legends like Randy Couture, Ken Shamrock,
Vance Rutten, always entertaining. Pat Miletich, a real pioneer.
and the trainers guiding them, Mark Delagrotte, Mike Winklejohn, plus medical perspectives, Dr. Gelber's work, Dr. Eswanek, who is foundational in ringside medicine.
So yeah, a deep well of expertise for sure.
Okay, so let's dive in. Where should we start? Maybe head trauma. That always seems like a major one.
Definitely. Head trauma and concussions.
Yeah.
And what's vital to grasp here is that the impact, it goes way beyond the stuff you see immediately.
Like broken noses, cauliflower ears, the visual stuff.
Exactly. Some guys
Mhm.
wear those like badges of honor, right? But the deeper concern is the often underestimated effect of head trauma, concussions.
Because fighters might just try to tough it out, that warrior mentality.
Precisely. That mentality can be, well, a double-edged sword. They might downplay it, try to push through when their body's screaming, stop!
And the symptoms aren't always immediate knockouts, are they?
No, not at all. That's key. You need to be really alert to the signs. Immediately after a blow, you might see confusion, maybe amnesia about the event.
Headache, dizziness.
Yeah, ringing in the ears, nausea, maybe even slurred speech, fatigue, obvious stuff sometimes.
But then there's the delayed stuff.
Right, and that's what makes it tricky. Difficulty concentrating, memory problems, mood changes, even slowed reaction times. These can creep up hours, even days later.
Wow. And Tim Sylvia's experience, that really hits this home, doesn't it?
It really does. After his fight with Arlovsky, he wasn't even knocked out during the fight.
No.
But later that night, bam, severe concussion, lost consciousness multiple times.
That's terrifying. A huge reminder you don't need that dramatic KO.
Absolutely not. And Renzo Gracie's perspective on when these injuries happen is insightful too.
What does he say?
He argues, pretty compellingly, that training is often the most dangerous time, not the fight itself,
Really?
just the sheer volume. Think
Right.
about it. Hours and hours in the gym, sparring, drilling, for maybe a 15-minute fight.
Yeah, the accumulated load.
Exactly. Renzo really stresses the coach's responsibility here. Limit the head trauma in training. And he strongly warns against that tough it out thing after someone's clearly been rocked.
Because it makes them more susceptible later.
That's his experience, yeah. Once you get one concussion, you're kind of set up for the next one more easily. He even points to Russian training, like 75–80% intensity, maybe being better for longevity.
That really shifts the focus, doesn't it? Prioritizing long-term health over just grinding people down every single session.
Totally. And Mike Winklejohn echoes this. He emphasizes the coach's role in watching for fatigue.
Why fatigue specifically?
Because when fighters get tired, their technique goes, right? Guard drops, reaction slow.
And they take unnecessary shots to the head.
Precisely. He's really against excessive hard sparring for that reason.
Okay, so this raises the question of intensity. How hard should you spar?
Well, Josh Barnett has a really thoughtful take on this. He accepts injuries are part of MMA. You can't eliminate them.
Sure, it's combat.
But he believes you can limit the damage significantly. He likes live training. It builds reaction time, managing impact, all that.
But controlled.
Yeah, maybe 60–70% intensity for head strikes and sparring. His point is crucial. You don't need to knock out your training partners.
Because then you lose a training partner.
Exactly. It's counterproductive.
And it's not just how hard, but who you train with, right? Don Fry mentioned weight differences.
Yeah, that's a big safety point. Fry warns against sparring someone like 25, maybe even 50 pounds
Hey,
heavier.
wow, 50 pounds.
Yeah. Imagine absorbing those heavier shots, especially when you're tired and can't defend properly. It's just unnecessary risk.
Makes sense. And Guy Mesger offers some really practical brain health advice.
Loads of it. He stresses sparring isn't for conditioning. Use it for technique. Stay fresh.
So what for conditioning then?
Pad work, heavy bag, sprints, stuff like that. And critically, he highlights neck strengthening.
Neck strength. How does that help?
It helps the body absorb the shock from head trauma better. We see guys like Stipe Miocic doing specific drills, mimicking dodging strikes to build that neck resilience.
Interesting.
Plus, Mesger hammers home the basics. Good nutrition, limit alcohol and drugs, get checked after any head knock, regular neurological checkups.
It's a whole package deal for brain health. Acknowledge the risk. Be proactive.
Pretty much.
Mm.
Okay, want to shift to something more visible.
Eh.
Lacerations, cuts.
Yeah, the bloody ones. They look dramatic, but they're a real concern too, right?
Huge concern. And not just for the fight itself. Mark Delagrotte's experience with Marcus Davis really shows the long-term impact.
Davis had prior boxing cuts.
Yeah, lots of scar tissue. So even relatively light shots in training could just rip those old cuts right open again.
Oof. So Delagrotte had to take special precautions.
Absolutely. Extra padding,
Yeah.
specialized headgear, just trying to manage that cumulative damage.
So scar tissue is a big factor, and when we talk bleeding, there are different types, aren't there?
Yep, basically two main types you need to know. Arterial and venous.
Arterial is the bad one.
It's usually faster, yeah. Comes from arteries. Higher pressure from the heart, it pulses, can spray.
And then venous.
That's from veins, lower pressure. Slower, more like a drip or ooze.
Yeah.
And Stitch Duran, the famous cut man.
Yeah, legend.
He points out that vein right between the eyebrows. That's a really common spot for significant bleeding.
Okay. And are there specific danger zones for cuts on the face?
Definitely. Cuts around the eyebrow, they can swell up, block vision, maybe even damage nerves underneath.
Below the eye, too.
Same deal. Different nerve, potentially. Eyelid cuts are risky for the eye itself, and cuts near the nose.
What's the risk there?
You could damage the tear duct, the nasolacrimal duct, messes with eye drainage and hydration. Stitch basically says if a cut's bad enough for a doc to consider stopping a pro fight.
You absolutely stop sparring immediately.
No question.
So what actually makes a ringside doc stop a fight for a cut?
Several things. Major arterial bleeding the cut man can't control. If underlying stuff like nerves or bone are exposed, if vision's impaired, blood in the eyes, or the cut's location blocks sight.
And those danger zones you mentioned?
Right, eyelid near the nose. Stitch often highlights blood getting in the eyes or just uncontrollable bleeding between rounds as key decision points.
The BJ Penn versus Joe Stevenson fight comes to mind. That cut was brutal.
Classic example. Stevenson's cut stopped the fight, and he was worried Stitch wasn't in his corner. Shows how vital that cut man role is.
Absolutely. So treating these cuts in the moment, what's the cut man's main tool?
Compression. Simple as that. Stitch emphasizes direct pressure with clean gauze. That's job one. Get it to clot.
What about those cold metal things they use, end swells?
Yeah, the end swell. Cold compression. Helps reduce swelling, constricts blood vessels, aids clotting. Very useful.
Any things to avoid?
Stitch cautions against anti-inflammatory sometimes, as they might increase bleeding risk slightly. And Delagrotte notes the end swell is useful even for bruises, hematomas, not just active bleeding.
Ah, for the swelling.
Exactly.
Yeah.
But obviously, any deep cut needs proper stitches later from a doctor to fix the deeper layers and minimize scarring.
And preventing infection afterwards is crucial.
Hugely. Stitch is meticulous about clean tools. Dean Lifter advises fighters maybe put a thin Vaseline layer on prone areas before sparring.
Like a lubricant.
Yeah, helps the skin slide maybe, reduce tearing.
Okay.
And always get cuts checked medically. Basic hygiene too, soap, water, keep it covered while healing.
And preventative gear in training.
Definitely. Delagrotte and Sean Shirk both stress good, well-fitting headgear. Shirk also warns about training with maybe less experienced or wild partners.
Riskier styles.
Can be. Don Fry even suggests Vaseline or, like, butter balm to soften the skin. And Josh Burnett. Strict rule. No uncontrolled elbows in training. Period. Cuts down on cuts.
So prevention, immediate care, proper follow-up, hygiene. It's a whole system.
It has to be.
Okay, let's move to another vulnerable area, the eyes. Eye injuries and orbital fractures.
Yeah, eye injuries. Scary stuff. Generally fall into two camps: abrasions and blunt trauma.
Abrasions or scratches.
Exactly. Scratches on the cornea, the clear front part. Feel sharp, like something's in your eye, sensitive to light. Needs antibiotic drops from a doc to prevent infection.
Then blunt trauma.
That's more serious. A direct hit can compress the eyeball, potentially damaging the retina at the back or the optic nerve.
What are the signs of that?
Flashes of light, seeing more floaters.
And-
Retinal tear is really serious risk of blindness if not treated fast.
And orbital fractures. Broken eye sockets.
Yeah, usually from blunt force.
Yeah.
Elbows are a common culprit in MMA. And what's tricky is they don't always stop a fight immediately. Symptoms can be subtle at first, maybe overlooked. Pat Miletich broke his from a head kick.
So prevention.
Right.
Sounds tough for eyes in MMA.
It really is. Complete prevention, probably not feasible given the sport. Mike Winklejohn's personal story is a sobering reminder.
What happened to him?
Lost vision in one eye, holding pads, got poked by a toenail.
A toenail.
Yeah. Seemingly minor incident, devastating consequence. Shows how vulnerable eyes are.
So the consensus is?
Any sign of eye damage, stop immediately. Fight, training, whatever. Halt everything. Losing sight in one eye, that's likely career over.
Man. What about specific advice for eye health?
Frank Shamrock's top 3 basics: strengthening, stretching, icing, apply generally. But he really emphasizes mental prep after an eye issue happens.
Mental prep. How so?
That mind-body connection. Using visualization, meditation, slow controlled movement to stay focused. Avoid making it worse if your vision is compromised.
That mental game again.
Uh-huh.
Crucial. Okay, let's move down the body. Knees. Huge source of injuries, right?
Oh, absolutely massive impact in MMA. George's St. Pierre's ACL tear in 2011. That was a huge deal. Really shows how it can alter a career.
Yeah, I remember that. So basic knee anatomy refresher.
Sure. You've got the femur, the thigh bone, sitting on the tibia, the shin bone. Between them, the Minishi cartilage cushions.
The shock absorbers.
Right. Then the main ligaments for stability: ACL in front, PCL in back, MCL on the inside, LCL on the outside.
And if the ACL goes, surgery usually involves a graft.
Typically, yeah. They use tissue to rebuild it.
Mm-hmm.
Common options are using part of your own hamstring tendon or your patellar tendon from below the kneecap.
Or from a cadaver.
Or cadaver graft, yeah.
Mhm.
Each has pros and cons. Patellar tendon, strong heel, maybe, but can cause pain when kneeling later.
Big issue for grapplers.
Definitely. Ed Herman chose a hamstring graft, partly for that reason, to avoid kneeling pain. Hamstring graft avoids that, maybe heals a bit slower initially. Cadaver grafts mean no harvesting pain from you.
But higher failure risk.
Slightly higher, especially in younger, active people. Ed Herman actually had both first hamstring, then later a cadaver graft for another tear.
Wow. Okay, so surgery is one thing, but what about before and after?
Rehab.
Crucial. Prehab, strengthening the leg before surgery, can make a big difference. Bruce Buffer talked about doing that.
The announcer.
Yeah. He tore his ACL. And post-op rehab, that's the long haul. 6 months, maybe a year. Focuses range of motion, rebuilding hamstring and quad strength. Slowly, carefully.
And recovery times have improved.
Massively. Mark Coleman tore his ACL early in his career. Much longer recovery back then. He regrets coming back too soon.
Lesson learned there. And finding the right physical therapist sounds key.
Essential. Ed Herman, Tim Kennedy, they both stressed working with PTs who really get MMA sports specialists.
Ken Shamrock had specific advice for regaining motion.
Yeah, especially for grappling. Getting that deep range back. Sitting on your heels, deep lunges, stuff like that.
Interestingly, Pete Spratt recovered without surgery. He did. Focused intensely on stability drills. Swiss ball work, leg raises. Found a way around it.
What about other knee ligaments? PCL.
Posterior cruciate ligament. Less common than ACL, but maybe more common in MMA than other sports because of takedown mechanics. Often treated with rehab, focusing on quad strength. Mark Hunt fought forever with a torn PCL.
Incredible. Meniscus tears.
The cartilage cushions. Also critical. Can be simple or complex tears. Sometimes they repair it, sometimes they just shave out the damaged part. Different recovery times, different long-term effects on the joint. Patrick Cote tore his mid-fight against Anderson Silva.
Ouch. So Shamrock and Lister say get meniscus issues checked.
Definitely. Pay attention. Consider surgery if needed. Don't ignore it.
Quad and patellar tendon injuries, too.
Yep. Tim Kennedy partially tore his quad training, rehabbed it. Patellar tendonitis inflammation below the kneecap, common from lots of kicking, jumping. Ruptures need surgery.
What about PRP, platelet-rich plasma?
Seeing more use for tendon issues, yeah. Potential benefits still being researched.
So preventing all these knee nightmares, what's the strategy?
It's got to be comprehensive. Good biomechanics first off. Strong surrounding muscles, quads, hammies. Dynamic stability exercises like
The
plyometrics,
training environment matters.
hugely. Randy Couture, Ricardo Liborio, they stress safe mats, not overcrowding. Greg Nelson warns about aggressive guard passing, putting stress on knees.
Tim Kennedy focuses a lot on prevention.
Big time. He builds it into his training. Specific exercises help. Medicine ball rotations, lunges, one-legged squats, band shuffles, plyo drills, plus traditional leg weights, extensions, curls, press, wall sits.
It's a whole routine. Strength, stability, smart environment.
You got it.
Okay, let's move up to the shoulder, another complex joint, right?
Yeah.
Lots of movement, lots of potential problems.
Very complex. Ball and socket, yeah.
Hmm.
Humerus head and the glenoid socket on the shoulder blade. You've got the labrum, that cartilage rim.
Add stability.
Deepens the socket, adds stability. Then the rotator cuff muscles, 4 crucial ones. The AC joint where the collarbone meets. Big muscles around it too. Deltoids, lats.
And common injuries.
Sprains, strains, dislocations, rotator cuff tears or tendonitis, biceps ruptures, labral tears, sometimes called SLAP lesions.
Gilbert Melendez separated his shoulder.
Yeah, from an arm toss. Came back relatively quickly, though.
Rotator cuff tears seem really common.
They are. Can range from just inflammation, tendonitis, to partial or full tears. Often the supraspinatus muscle involved. Pat Miletich took 8 months to recover from one, used water resistance training.
Sean Shirk fought with one torn.
He did, but stressed how vital proper rehab is after surgery. Past Rutten dealt with biceps tendonitis, front shoulder pain, mostly with rest and working around it.
And biceps can tear right up at the shoulder.
Yep. Carlos Newton's story is interesting. MRI looked like a partial tear, but surgery showed a complete rupture. Had a reattached tenodesis surgery, successful recovery.
Matt Serra fought with a torn biceps too.
He did. Ray Longo, his coach, brings up that tough call.
Mm.
Fight through it or prioritize long-term health. No easy answer sometimes.
Labral tears the cartilage rim.
Right. Often from dislocations or forceful backward arm rotation. Demetrius Johnson had one fixed with arthroscopic cleanup debridement and PRP.
And coaches like Javier Mendez are strict about return to play.
Very strict. Need full medical clearance, proven recovery before getting back to full training after a shoulder injury.
So recovering from shoulder stuff, what helps?
Focusing on other areas while you heal, like Gilbert Melendez did, light resistance therapy for the shoulder itself, body awareness exercises,
And prevention.
stretching routines like using a broomstick for range of motion, resistance band rotations, light weights focusing specifically on those rotator cuff muscles.
Rest, rehab, prevention seems to be the theme.
Pretty much the foundation.
Okay, down to the hips. Crucial for power, stability.
Absolutely. Another ball and socket joint. Femur head in the acetabulum socket in the pelvis.
Yeah.
Also has a labrum. Surrounded by big muscles, hip flexors, quads, hamstrings, adductors, the groin.
Cryptics on the outside.
Right. Common issues. Muscle strains, especially groin pulls adductor strains. Labral tears in the joint. Hamstring ruptures up near the hip.
Mark Coleman's hip issues were severe, weren't they?
Yeah. Ended up needing early hip replacements due to cumulative trauma. He also mentioned hip pain can show up elsewhere, like the groin or knee, making diagnosis tricky.
Ricardo Liborio noted wrestlers might be more prone.
Yeah, potentially due to the specific stresses of wrestling movements.
Flexibility seems key for hip health.
Hugely important. Frank Shamrock, Gilbert Melendez both emphasize hip flexibility, regular stretching, foam rolling, butterfly stretch, splits, dynamic stretches.
Cesar Gracie mentioned hip flexor injuries from throws.
Common mechanism, yeah. Carlos Newton adds advice on learning to fall properly, distributing impact. And being aware of mat conditions slipping is bad news.
Hamstring injuries again.
Yeah, ruptures high up near the hip, often from hyperextension. Parisian tore his hamstring.
And it actually helped his striking.
Paradoxically, yeah. Couldn't grapple as much, so he focused on striking during recovery. Improved that part of his game.
So exercises for hip strength and flexibility.
Rotational stretches for the outside structures. Lunges for the front hip stretch. Foam rolling. Core stuff like planks, side planks with leg raises. Eccentric exercises with a partner controlling the lengthening phase of muscle contraction. Builds resilience.
Good stuff. Moving down to the hands now. Very common injury site in striking, I imagine.
Extremely common. Mostly fractures and dislocations. You've got the metacarpals in the palm, phalanges in the fingers, all those little joints, MCP, PIP, DIP, plus the tendons that move them all.
And the boxer's fracture. Hear that one a lot.
Yep. Fracture of the neck, of the fifth metacarpal, the bone leading to the pinky. Super common from hitting wrong, bad technique.
Treatment.
Realign it, immobilize it, splint or cast. If it's unstable, might need surgery with pins or plates. Got to respect the immobilization time, then slowly get motion back.
Josh Barnett had tips for training with a hand injury.
Yeah, focus on the good hand. Use gel padding if knuckles are just sore. Mark Delagrotte teaches how to make a proper tight fist to prevent these in the first place.
What about tendon injuries in the hand?
Also significant, extensor tendon rupture, leaves mallet finger, can't straighten the tip, flexor tendon rupture, jersey finger, can't bend the tip, boxer's knuckle is a tear in the tendon hood over the knuckle.
Surgery needed for those.
Often, yeah, to restore function. Pete Spratt ruptured a thumb tendon, needed surgery and pins.
And hand wrapping is obviously vital.
Can't overstate it. Proper wrapping supports everything, prevents injuries. Delagrotte and Richard Fox give detailed instructions on good Mexican-style wrapping. Provides great protection.
Okay, let's shift gears completely. Skin infections. Sounds unpleasant, but a real issue in grappling environments.
Huge issue. Can be serious, sideline fighters, spreads easily to training partners. Nasty stuff.
What kinds are common?
Herpes gladiatorum, that's the herpes virus. Skin-to-skin contact, looks like cold sores, very contagious when blistering. Impetigo-bacterial, staph, or strep. Yellowish blisters, honey-colored crusts, also super contagious. Demetrius Johnson had it.
And MRSA, that sounds serious.
It is. Methicillin-resistant staph aureus. Antibiotic-resistant staph. Needs prompt medical attention. Mark Delagrotte dealt with a staph outbreak on a Diaz. The Ultimate Fighter had to sanitize everything. Mats, walls, stability balls, the works.
Wow, ringworm too.
Tinea corporis, fungal infection, red, scaly, ring-shaped rash, also skin-to-skin transmission.
Prevention tips for these.
Sean Shirk, Dean Lister, wear shirt for grappling, shower immediately after training, use antifungal creams if needed. Dan Severn, Frank Shamrock, Hammer, home hygiene, clean your gear, clean the mats. Crucial.
Okay, last major area. Broader issues like weight cutting, PEDs, TRT. These link into health and injury too, right?
Absolutely. Dangerous weight cutting, extreme dehydration, starving, diet pills, laxatives, huge risks, electrolyte imbalances, organ failure.
Like Daniel Cormier's kidney failure scare.
Exactly. Marcus Davis had severe dehydration issues. Rory Markham, a collapsed lung from cutting. It's serious.
Needs better regulation.
Definitely a growing call for it. Maybe re-weighing fighters closer to the fight, stricter limits on how much weight can be cut. The NCAA has a 1.5% per week rule, much safer. Healthy weight loss is about calorie deficit diet and exercise.
And PEDs and TRT. Always controversial.
Always. PEDs are banned, obviously. TRT, testosterone replacement therapy, is more complex. Some fighters have low testosterone.
Why?
Could be past steroid abuse, chronic painkiller use, history of head trauma, even the stress of repeated extreme weight cuts.
So the debate is whether TRT is legitimate treatment or an unfair advantage.
That's the crux of it, especially if the low T might be linked to the sport itself, like head trauma or weight cutting. Big commissions like California and Nevada stopped giving exemptions for it.
And supplements.
Sketchy area, often lacks solid scientific backing. Big risk of unregulated ingredients or contamination with banned stuff. Got to research carefully, talk to a doctor.
Okay, pulling all this together, what are the main takeaways? The key lessons on injury prevention from all these experts?
Several big themes emerge. 1. Choose your camp wisely. Good people, continuity, like Randy Couture advises.
Surround yourself with the right team.
2. Be a good training partner. It's give and take, respect, safety. Josh Barnett, Matt Lindland emphasize that. Reliability, humility. Dan Severn talks about balanced camps.
3. Educate yourself. Barnett's point, invest in knowledge, learn from pros like Stitch.
4. Use proper gear, always. Quality stuff appropriate for the training. Bass Rutten, Delagrotte stress this, headgear included.
5. Avoid the last week curse. Dean Lister's warning, don't train super hard right before a fight, risk injury.
6. Avoid overtraining. Huge. Couture talks about consistent fitness, listening to your body. Barnett, Carlos Newton on recognizing the signs, keeping logs.
And the big one seems to be train smarter, not just harder.
That's the umbrella, really. Technique, strategy, listening to your body over just brutal intensity. Cross-training, active rest help too. Miletich, Severn, Sylvia mentioned that.
Greg Nilsson and Matt Brown compared the body to a machine needing maintenance.
Yeah, great analogy. Needs proper care. And finally, structure your camp effectively. Balance different training. Build in rest. Nelson, DJ, Miletich gave examples of good weekly schedules.
Wow. Okay, that was incredibly thorough. So for you listening, a few key takeaways really jump out, I think. First, that critical importance of listening to your own body. Knowing the difference between pushing limits and risking serious injury.
Huge. Self-awareness is paramount.
Second, Those hidden dangers in training mat sanitation, maybe sparring partners who are way too heavy or uncontrolled, stuff you might overlook.
The everyday risks, yeah.
And finally, all the proactive steps fighters and teams can take. Smart training, good gear, getting expert medical help. It's about prolonging careers and minimizing long-term damage.
Definitely. And what this deep dive offers really is a shortcut. It distills all that hard-won experience and expert knowledge into one place for you.
Exactly, drawing from the best in the business. Which leaves us with maybe one final thought to chew on.
Go for it.
Considering the insane physical demands and the undeniable risks of MMA, what are the broader implications here? For athlete welfare, for how sports medicine evolves in combat sports?
That balance.
Right, the balance between pushing human performance to its absolute edge and ensuring these athletes have long, healthy lives after the cheers fade. Something to think about. Thanks for joining us for this deep dive.